Namaste, Jessica ji.
Namaste, Saurabh. I'm sorry I cannot turn on the video because the signal is currently not good. So I'm just
Yeah.
paying attention to what you're gonna say.
Okay, it's okay. Totally fine. Okay, sit in any comfortable position. Keep your back neck straight and gently close your eyes. Take a deep and long breath in and deep and long breath out. Prepare yourself for today's class. Prepare your body, your mind, and your breath. Bring awareness to your breath. And prepare your breath for the upcoming pranayama that we're gonna do today. Set up intention if you have any intention that you want to set up for today's practice. Now join your both palms together in front of your heart center. We will begin our class by chanting 3 times Om. Take a deep inhale. Gently bow your head towards God. Bring your head back. Rub your both palms together. Gently apply it to your eyes. While blinking, looking at your palm, open your eyes. Om Shanti. Okay. Okay, so today we're gonna learn the pranayama, that is Bhastrika. It is also known as yogic breath of fire. Okay. So today we're gonna learn this pranayama. First, we're gonna talk about the technique of this pranayama, that how we're gonna do this Bhastrika pranayama. So yesterday we have learned the pranayama Kapalbhati. We have seen in Kapalbhati that we inhale passively in that and exhale actively. Bhastrika will inhale also active inhalation, and exhale also active. So in this, we inhale and exhale both actively. Same like Kapalbhati, we are exhaling. In this, we will inhale, exhale through our nostril, and we'll exhale through our nostril. It's like we will do it quickly. Before doing this practice, we'll talk about now precautions of this breathing technique. So there are some precautions we have to follow. Try to just do this breathing technique only for, I'll suggest 4 to 5 minutes. Do not extend more than that. So 4 to 5 minutes, you have to practice it. Okay? Do not cross it. What happens when we do fast inhalation and exhalation? In this, the body creates heat. So we don't require excessive heat in our body. So it's enough to do practice for 4 and 5 minutes and then normalize it. Do not extend it more than that. If someone is having high blood pressure or the hypertension, again, they have to be careful while doing this practice, because as we know that this pranayama or the breathing technique gonna be creating heat in your body. So excessive heat for the patients like high blood pressure or the hypertension can be risky. So they have to be like doing it in a slow pace, not very fast. They can do it, but they have to be careful, or they can do under a good teacher, or they can ask the doctors. Third one, if someone is having any type of heart diseases, same in case of heart diseases, or we can say cardiovascular diseases. In that case also, there should be very careful while doing this pranayam. They should do it slow, same like high blood pressure and the hypertension. If they feel any uncomfortableness in their body, they just really have to come back and normalize their breath. Do not continue the pranayam. Fourth, any type of recent surgery. If someone is having the recent surgery, any type of, they should avoid doing this pranayam until unless their surgery becomes like 6 months old or something. After that, they can go for this pranayam, at least 6 or 7 months. Next, pregnant ladies. Again, pregnant ladies cannot perform it, or ladies who are on their menstruation cycle. They should also avoid this pranayam, because already a human body is going in a process or something. So they should not do this Bhastrika pranayam, the yogic breath of fire. So as we can see, the name of this pranayam is yogic breath of fire, because it creates heat in your body, a lot of heat. So that's why there should be we should take precautions performing this advanced type of pranayams. Okay, so now we'll perform this Bhastrika. Then we'll talk about the benefits of it. First, we'll see what is happening when we are doing this Bhastrika pranayam. You can sit into any comfortable position. You can sit into simple cross leg, or you can perform Siddhasana or Siddhyani Asana or lotus pose as well. So you can perform it like this. Okay, keep your back neck straight. It's very important to keep your spine straight in one line. Otherwise, you will not feel that openness in your chest. If you will roll your shoulder like this, or you're gonna make a hump on your back, it is not good. So always roll your shoulders out, open your head, let your lungs get that space to spread nicely, and you can inhale smoothly. Close your eyes, but if you want to see, just look at me how you have to do it. So you have to take an inhale, exhale. Try to fill your lungs while inhalation up to the maximum. So this is a beginner level. That's why we are doing it very slowly. Now you can perform it. If you're gonna perform it with the closed eyes, then gonna be much better, because with the closed eyes you can focus more smoothly or more betterly on yourself. Do it 5 times. In 5 times only, you will feel that heat that is created in your body. Just after doing 5 times, you can feel that your body is creating a lot of heat. I will also write some more precautions. If I'll say, in like excessive summers time, do not perform it. In summers, Do not perform it. At the time of fever, again, if someone is suffering from fever, avoid doing this. Epilepsy, if a patient is suffering from epilepsy, in that case also, they should not perform this pranayama. So we have done the basic technique of this pranayam, Bhastrika pranayam. If we're gonna talk about the advanced techniques or the like, if we're gonna move further advance in this breathing technique, what we can do? So we can simply increase the pace of our inhalation and exhalation. So before we were doing very slow inhalation and exhalation, but now we're gonna do it very fast. So you can do it like this in a pace, in the increased pace. If you wanna come back, just exhale, normalize your breath. In like one go, you can, in like one time, you can do it for 5 to 10 times. At a beginner level, I will say be careful, 5 to 10 times is enough. When you feel comfortable, that it's easy for me to do 5 to 10 times. So you can go more further, 10, 15 times or 20 times in one go, in one breath. Remember, when you'll come back, exhale a long exhalation and then slowly normalize your breath. So you can do it like this. If we're gonna say like we can do this pranayam with the movement of our hands. So we can use our hands also for performing this pranayam. How we will use hands? We can keep our hands in line in like this. Okay, make a fist. So while inhale, stretch your arms over your head. Open your fingers, spread it out. As you exhale, jerk yourself forcefully. And I release the air out forceful. Inhale. Okay, not only up and down movement, you can spread the hands out. So you can feel the heat, not only sidewise, but front also. So this we can perform with this is more advanced. I can feel sweating now because of this creating heat, because of this breathing technique, my body is creating a lot of heat. So I will write one more precautions. As you can see that you have to very precautive at the time of you are performing this pranayam. So be careful. Do not do it if you have something of these diseases. And then if you have excessive pith, okay, your pith level is excessive in your body. At that time also you have to be careful. Do not perform this pranayam, because what is going to happen, your pith is already increased. It means your body of heat is at high level rather than it is required. So this pranayam will increase it more. So you will have a lot of problems related to pith, indigestion problem or the acid reflexes, skin problems. So be careful with it. Access to avoiding excessive pith. Okay, so enough. Now let's talk about the benefits of this pranayama. There are a lot of benefits, same as we have a lot of precautions. We have a lot of benefits as well. Okay, so we'll talk about the benefits of this pranayama. So as we can see, it is creating heat in our body. So in winters, when our body temperature is low or the atmosphere temperature is low, at that time it is very good to perform this Bhastrika Pranayama. Winters. At winters, you can try this pranayama. If person is suffering from low blood pressure, it is very good for them because it will increase the blood flow in your body. So it is very good for it. It helps in opening your blocked nostril. So for blocked nostrils, it is very good. It is good in your cold and cough. It is good for if your body's vata is increases, as we know when our kapha. If when our body's kapha increase, so what happens? Our body temperature goes down, and we suffer from the problems like cold and cough, excessive mucus in our body, or we can say we can suffer from sinusitis if these problems stays continue. So at that time we can perform it. So it helps in balancing your kapha, excessive kapha balance. So as I told you, cold and cough, if your body is making excessive mucus, at that time also it is good to perform. This will reduce the mucus production in your body. So we have written it also helps in removing the toxins from your body, as we are exchanging the gases very rapidly while doing inhalation and exhalation. We are exchanging the gases, so the toxins will remove definitely from your body. So it removes toxins. Okay, it is good in your respiratory problems. Respiratory problems like asthma, bronchitis. In that case, you can perform this pranayam. It will definitely gonna help you in overcoming your that diseases, respiratory diseases. One more thing, as we can see that we are inhaling, exhaling very fast, so it helps in expanding your lung region. So it helps in the expansion of your lungs. And it also helps in opening your heart region, as we are inhaling, exhaling very fast. So our rib cages opens and it creates space for your lungs to expand more. So it's a process, totally process. Like your rib cages will expand, it will create a space for your lungs to expand more. Okay. So, the most of the oxygen, uh, three organs that take lot of oxygen from the body. One is brain, second we can say liver, and third is heart. These three internal organs take the most of the oxygen of the body for the smoothing of our functions, body functions. So what happens when we do this pranayam? It gives proper oxygen to the liver, and liver helps in creating the bile juice, which helps in um, you know uh, digesting the fat. Liver helps in digesting the fat of the body. So what happens when our liver does not perform properly? We just eat any type of food. It like our weight start increases rapidly. It doesn't matter if we eat very little. What happen? It will just increase our weight without eating more. So that means if your weight is increasing unnecessarily, it means your liver is not functioning properly. So at that time, you can do Bhastrika Pranayam. It will improve the function of your liver and it will digest the fat of your body properly. So improves the functioning of liver. Okay, so it helps also in increasing the immunity system or the metabolism, both. So increases your immunity system and your metabolism, both. Boost, we can say it boosts your metabolism. So you can see this pranayam has a lot of benefits and a lot of precautions. So I hope if you wanna like try this pranayam, you get the benefits of this pranayam, but definitely take precautions, because if will not take the precautions, it will not be taking the precautions properly, it may harm ourselves. So be careful. You can do this pranayam early in the morning, empty stomach. It is very important. And for no, do not exceed more than 4 or 5 minutes. It's enough. You can perform it for 4 and 5 minutes. Take regular gap in between them and do it accordingly. If you feel any dizziness, you can feel a dizziness little bit in starting, obviously, because the blood flow increases rapidly and your blood pressure shoots up. So that's why you can feel that little bit heaviness and dizziness. If you feel like this, just come back, normalize your breath, or you can go for the child pose as well. If you wanna like do a counter for Bhastrika, you can do the left nostril breathing for few rounds and your body will become again back to the normal. So if you have any questions, any doubts, you can ask me.
Yes, I have two questions actually.
Yes.
So I tried the breathing and I feel some kind of headache. So did I do it properly? I'm not sure. Or can I do it not that forcefully for the
Yeah.
exhale and, inhale?
Yeah. As I told you, you can feel that little bit heaviness and the dizziness in your head. So what you have to do, you have to just reduce the pace for now. It means your body is not prepared to go that much far for now. So you should reduce the pace. Then you will feel little bit that heaviness or the headache, little bit. But then you have to suddenly make your body comfortable by doing the regular and slow practice of it until unless you reach up to that point where you can extend your practice further. Do not go for the like advanced thing, be at the basics.
Okay, do you have any recommendation of how many should I do in 1 minute for the kind of breathing?
In 1 minute, I'll say do not in one time, because it's like in one time we inhale exhale. So in a one go you can go for like, if for a beginner I'll say 5 to 10 maximum, and do in 1 minute, do 3 rounds. So take 5 to 10 inhalation and exhalation like this. As you complete 5 or 10 times, stop it, normalize your breath. If you feel like now my breath has become normal, go for the second round. Again, do for 5 to 10 counts, inhale and exhalation. Again, normalize your breath and hold there. Let your breath become normal and go for the third round. So it's a round you can do for 30, 30, or if you'll go for the 5, you can go for the 15 or 30 in 1 minute, inhalation and exhalation. But it should be like you should take break in between 15, 30, not in one go. For a beginner, it should be less, 15, 30 in like 3 rounds you are doing that.
Okay, thank you. And the second question is, so I took like Ayurveda type of body quiz this in the internet, and
Mhm.
I think I have a Pitta and Kapha mixed body type, but dominantly the Pitta type. So do you think I should do this? Can I do it like frequently every day, or some days maybe in the week? What do you suggest? Thank you.
Your pitta is also increased and your kapha is also increased.
I think I'm dominantly pitta.
Your pitta is dominant.
I
Okay.
think
You think,
that's the quiz set.
you can be sure by asking, the therapy teacher. She will tell you that, if you will just talk to her, she will definitely tell you that your which is more increased, your pitta, your kapha, she can, or your vata. She can tell you more
Oh, okay.
goodly. Yeah, Ayurveda teacher or the therapy
Okay.
teacher. But if you are asking a question about if you have like excessive pitta in your body, I will suggest you to not perform it on regular basis. Perform it in weekly 2 or 3 times and do it for very less, because pit it means only that it can create excessive heat in the body. So this is gonna be creating more heat. So I'll suggest you to perform it twice or thrice a week, and do it for just 1 or 2 minutes, not more than that.
Okay, that's really nice to know. Thank you. I will
Yeah.
definitely ask Durgesh about this. Thank
Yeah,
you.
yeah, she will tell you much better.
All right. Thank
Okay,
you.
okay. So let's finish our class. Sit in any comfortable position and gently close your eyes. Take a deep breath in and deep breath out. Now we will chant one time Om followed by three Shanti. Take a deep breath in. Om. Shanti, Shanti, Shanti. Join your palms together. Rub your palms. Apply to your eyes, to your face, to your whole body. And gently, while blinking, open your eyes. Om Shanti.
Om Shanti.
Take care, Jessica ji. See you tomorrow. Have a good day.
Have a great day to you too, Sora. Thank you so much.
Welcome.